Who's responsible? This guy right here. I'm responsible, and we'll do everything we can to make sure that we protect these kids. And I feel we got the best advice. I personally feel, I'm a little biased, but we have the best plan in the entire country.
That is Ontario Premier Doug Ford defending his back-to-school plan. One of the key measures in that plan is mandatory mask wearing all day for most students. Alberta has announced masks will be required in common areas in schools, but public health officials around the country have different takes on the issue.
If you're older kids, it's another layer of protection. I think schools should recommend it. Younger kids develop, mentally speaking, it needs to be adjusted to their ability to wear it. But also, if someone wants to wear a mask and they're young, let them. Don't stigmatizing them. Don't single them out in any specific way. It is an added layer of protection.
No, we have no intention for making mandatory masks, and I actually don't believe there's evidence to support mask wearing by children in the classroom setting.
So who should governments and parents be listening to help unpack this topic further? We're joined now by Dr. Kashif Pirzada. He's an emergency room physician and co-chair of Masks for Canada, a group that wants the wearing of masks mandated in all indoor public spaces outside the home. He joins us from Toronto. Welcome to the program, Dr. Pirzada.
Thank you.
I think to start with, I'd really like you to lay out what you believe is the optimal scenario in terms of kids wearing masks in school. So what ages are we talking about? Are we talking about all day in your mind? What would you like to see?
So as we look across the country, we're seeing sort of a hodgepodge of requirements. So Ontario seems to have the most stringent ones where they're requiring masks at grade 4 and above. We believe this should extend down to kindergarten.
Wow.
We're collecting more. I think more and more information is being collected. We always found with our group that public health recommendations are always about 1 to 2 months behind the existing evidence. We're already seeing, because some states start their school year earlier, so we're already starting to see outbreaks in U.S. schools and U.S. summer camps in crowded conditions without masks. So we think it should apply to JK and above.
And are you talking all day? Like, I'm trying to imagine a kindergarten student wearing a mask for 6-7 hours. Is that realistic?
No, it's going to be difficult. There's going to be some adjustment and training, but we have a toddler we're trying to toilet train.
Good luck to you.
Yes, thank you. So I think it's easier to teach a child how to wear a mask than I think to toilet train. And I think if you look at it, there's a mask requirement. If I take my kids to the grocery store and they're above 2, they have to wear a mask. But then they can take them off in school. That doesn't make a lot of sense.
But to be clear, all day you're saying, like throughout the day,
I think the Alberta government has a great way around this. Like, they're giving 2 masks to every student. We think with proper training, students can be able to take off and put on a new mask every day safely. But source control is very important. We know this virus is transmitted by droplets and aerosols, and just blocking that from the get-go is going to help a lot, hopefully.
I think it's important to ask you to address what Dr. Henry said in the clip that we played in the introduction there, and she was really definitive yesterday. And when we look at health officials across the country, she certainly is one who is being vaunted for the decisions she has made to protect people in British Columbia. I mean, she really said, no way, no how, the evidence is not there. I do not think it should be mandatory. So how do you respond to that?
This, BC is fortunate that it had a fairly light first wave. We weren't so lucky in Ontario, and it was even worse in Quebec. So, the situation and context is different. I have a lot of respect for Dr. Henry, especially with what she was able to accomplish there. But, the context is very different. We have, thousands of people died here, even more in Quebec. I think we've seen really positive uptake and a decrease in numbers in Ontario just in the last 2 weeks since most municipalities passed their masking bylaws. And regarding evidence, really high quality evidence will not be available until far after the pandemic. This is the third time I've been fighting this issue. The first time was in February, March in our hospitals when we were told that masks aren't necessary. And so we sort of had an uprising, and then across the GTA, patients, visitors, and doctors and staff and nurses were all masked. And thankfully, there's been almost no infections in our staff. Then the second wave happened around with municipalities. We ran into the same arguments that there's not enough evidence, but we were able to get bylaws passed, and numbers, thankfully, except for the one area in Ontario that doesn't have masking laws, Chatham-Kent, are dropping everywhere. And now the third time, this time with a different set of bureaucrats and a different set of arguments, but the same complaint that we don't have evidence. But I don't think we can wait that long. There is some evidence already.
Part of the argument, as I understand it, and I think everyone has probably figured out I'm not a doctor by now, but that it's different with children, right? There are questions, and I appreciate that. What I understand as a parent is that there's, you see different studies flying by, but that we should not regard students, the younger children, their ability to transmit the disease and transmit it to adults, but also their ability to keep those masks on all days. That makes it a different case.
No, it's challenging. And, I can't say we have all the answers on this, but, masking is, I think, the most important part of a whole set of measures, including, there needs to be better ventilation. In my hospital, the air cycles every 6 minutes. I think in most older buildings, especially older schools, it's only 3 to 4 times a day. There should be smaller class sizes. I think, Ontario is going for cohorting. We're not sure what the plans are for other provinces. There needs to be physical distancing between students. Mm-hmm. But I think, masking is a definite one of the most important parts of that. And how we can get students to wear it all day, I think it's sort of a cultural shift that has to happen. But, we can start normalizing it now. We can start showing our kids how to do it. And I'm already seeing at least in my neighborhood and in the local grocery store, well-behaved kids of all ages are wearing them. How long it is, we'll have to see, but it's better than doing nothing. We know, thankfully that children don't get as sick with this, but we can't say the same about their teachers or the other workers in the school. And I fear for them because, we had the same fear in March when all this was coming down, and they're going through the same fears right now. We should do everything we can to give them the best shot at avoiding getting sick.
As I'm imagining a parent watching this at home, and I'm just trying to situate, I guess, you in this debate. You talked about that uprising, as you put it, at your hospital. We hear where Dr. Henry stands. People may know that Sick Kids Hospital in Toronto, when it put out its recommendations in terms of the return to school, it did not advocate for mandatory masks. I mean, do you view yourself as somebody who's a bit more, extreme, let's say, when it comes to the mask debate? You have stricter standards?
I would say, I'm an emergency doctor, and the founders of our group and myself were emergency doctors as well. We're proactive about this kind of thing. Mm-hmm. Public health and guidelines, and these are August panels that take time to deliberate. They take months to accumulate new evidence, and I don't think that's a situation where we can wait. I'm not seeing sort of outbreak management plans in any of the school boards or the provinces. What are we going to do if a whole cohort of students are sick? We don't really have a plan for that. Masking is one way to sort of get around that. But, also we should know that sick kids, this is the second version of their plan. The first version, caused a huge public outcry. And if you look carefully at their document, the part on masking, there's a lot of dissent. I think fully 1/3 of their experts were opposed to what their final recommendation was. So I think very much it's a work in progress. I'm very encouraged to see that in Ontario, at least, the Premier has gone beyond even what Sick Kids is requiring by requiring masking at grade 4. Where Sick Kids didn't even call for that. So I think there's room to work with. Okay, but I don't think it's an extreme position at all.
Okay, before I let you go, I do want to just pull away from masking specifically. And I mean, it's so challenging given that the situation is different in every province and the rules are different in every province. But these are more crowded spaces at a time when we're supposed to be physical distancing. I mean, what would your takeaway message be to parents who are wringing their hands right now about whether or not to send their children back to school? This is about more than just masks. It's about safety overall. What would you advise?
I think, we need to encourage our government to be cautious, plan for the worst, hope for the best, but plan for the worst. I think do everything possible to prevent a big wave in the fall and to prevent a second wave in the fall. And I think we're far from that. I know, talk to your politicians, call your MPP, get them to do everything possible to keep our kids and staff and teachers and everyone safe. But I don't think we can. Sorry, go ahead.
No. You mentioned a toddler earlier, so not school age. But I wonder, would you send a child to school right now, knowing the plan
right now,
as it is?
As it stands, I would not send them right now. I'm going to keep them at home. We were planning preschool, but not anymore until things get better.
Okay. Well, we're going to leave it there. Thank you very much for your time today.
Thank you very much.
That's Dr. Kashif Pirzada joining us from Toronto. Now, that was one side of the debate around masks and making them mandatory in schools. We hope to bring you the other side of that debate later this week.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.